Precious. Precious Malenga from Zambia. I'm 27 years old. I'll be 28 tomorrow. I had a brain tumor. It was in the brainstem. It sat in a very sensitive area, and they could not do the operation back home in Zambia. So I could not afford the expenses to come to Yashoda, and I applied to the Ministry of Health back home. They did recommend Yashoda as a hospital that I should come to. When I came here, my expectations were not, I was not expecting a good hospital. Initially, I was supposed to go to Delhi, but they recommended this hospital. When I came here, it was a different story. They have good teamwork. Upon arrival, there was someone waiting for me from the department at the airport, and I was driven to the hospital. And just upon arrival, I rested, and I had several tests done, and scans, and almost everything was done. The following day was I reached here on the 22nd. The following day, tests continued. I had x-rays done, I had scans done, and on a Sunday, on the 24th, they explained to me what I was going to go through. It was going to be a long procedure, a long operation, and they explained to me that it was going to be about 8 hours. That surgery took place on a Monday 25th, where they had to cut my skull on the right because the tumor was more inclined on the right, and it affected most of the body parts. And I went in at 7:20. Actually, they woke me up. And they woke me up, prepared me for surgery, and when I went through, I went to the pre-operation ward. They prepared me, and I went for surgery. I didn't know anything. And a day before, that was on a Sunday, they explained that they maybe 95% of the tumor could be removed. That 5% was a maybe, but they managed to remove the 100% of the tumor from the brainstem. That was on a Monday, and on around 18:30, I came back from the surgery. They took care of me, and on a Tuesday around 12:30, I was out of intensive care unit. I must say the doctors are dedicated. One, they're dedicated. Two, they believe in teamwork. I must recommend them for teamwork. They work as a team, from dietitians, surgeons, general doctors, to auxiliary because they work as a team. And when I came back, they took care of me. And the first few days I couldn't sleep. I had nightmares here and there. The nurses were there to take care of me, to chat with me, up to 4 a.m. when I was awake. They managed to take care of me. They gave me, let me not talk about food. Food was given at the right hours. Breakfast was given between 8 and 8:30 a.m. and it was according to a prescription. Lunch was given mostly around 12 p.m. and 1 p.m. mostly, and it was done to our prescription. We wanted mild. We're Zambians, we're Africans, we don't eat spicy foods so much really, but they managed to tone down according to our test. When it comes to the room, the auxiliary staff were very friendly. I must say they were friendly. I made a few friends. The auxiliary staff was there to clean the rooms. The rooms were okay, they were up to standard. I must say they were together. From the auxiliary staff to Dr. Anandh, who did the craniotomy surgery, they were together. From the day I arrived to the day I did the surgery. And after the surgery, they took care of me. And when I was eventually discharged, they still check on me. So I have to recommend Yashoda. I can recommend Yashoda for any problem because it's a big hospital. They have 3 major hospitals. Yeah, three major hospitals from what I've read. 3 major hospitals, and they're very good at what they do. They have specialists for particular problems, even bigger problems than I had, and they're able to, out of 100%, 95% they do the work. So I can recommend Yashoda for any problem that is big, because they're good. They have teamwork and they're dedicated.
Yeah, Mrs. Precious came to us with difficulty of numbness on one side of her face and difficulty in walking with imbalance. And on examination and doing an MRI, we found that she had a large tumor in the next to the small brain, pushing all the nerves surrounding, which are responsible for her feeling of the face, for movement of her face, and for swallowing, and for movement of her eye. Mrs. Precious came to us with problems of having numbness on the right side of the face, with difficulty in walking and imbalance, and we found that she had a large tumor in the next to the small brain, near all the nerves responsible for movement of her face, sensations of her face, nerves next to her hearing on that side, and nerves responsible for her balance and the power on the opposite side limbs of her body. And once we saw this tumor on the scan, we knew it was not a very regular tumor, it was a very large tumor, but it had spread along from the nerves to pressing on the brain severely and producing even a stagnation of water in the brain. So after due examination and preparation, we took her up for surgery. With proper nerve monitoring, we monitored all the nerves that were there in this part of the brain using intraoperative electrophysiology techniques. We did with intraoperative nerve monitoring, we did a major surgery which lasted for almost 8 hours, and the tumor we found was going around all the nerves on that side of her brain responsible for the movement of her face and for hearing and for sensation of her face. Thanks to the monitoring that we were doing, we have been able to preserve all the nerves completely and well. And after we thought we have resected the tumor, we went ahead and did an MRI which is available in the operation theatre in our facility. So this is called the intraoperative MRI, and because of this we could find that there was some tumor left behind at the margins at the top of the cavity, which we could go back and remove on a second attempt and ensure that the complete tumor was removed. And thankfully the patient withstood the procedure very well. Surprised very well after the surgery, now that except for the numbness on that side of the face because of the tumor arising from that particular nerve, she does not have any new problems, and all the imbalance and weakness of her hands and legs has dramatically improved, and now she is doing well, and her wound has healed well, and she is fit to travel back home safely.